Hello everybody. In this presentation I'm going to tell you about facial nerve and its functional components, and this I'll be explaining with the help of animations. If you want to know the details like the different nuclei associated with facial nerve, the intraneural course, the intracranial course, intrapetrous portion, and then extracranial course including the clinical and applied anatomy, remember the supranuclear, infranuclear paralysis and all the details I have already uploaded in 2 videos around 2 months back. If you browse my playlist, you will find the 2 videos. So if you want to know the details, you can watch those videos. Right now my focus will be on the functional components about the facial nerve. Okay. So let's start with facial nerve. You know that facial nerve is the posttrematic branch of the second branchial arch. What do you mean by this posttrematic branch? Any idea? So let me explain you about this pre and post-traumatic concept. Many of you may not be knowing it. So let me tell you that this what I'm drawing is the pharyngeal arches. This pharyngeal arches section I am drawing is actually a coronal cut section. So this is the mesenchymal ridge. It has been divided into, actually there were 6 arches, right? But the 5th arch, that disappears during the course of development. And these arches on the outside, they are lined by ectoderm. And this ectoderm, you see from outside, it has these clefts, right? And or the trench sorry. So because it has these trench on outside, it's called clefts, and you call it as ectodermal clefts. But on the inside there are these endodermal lining, and this is called endodermal pouches. So got it? So all the 3 germ layers are here, and there will be structures derived with the help of these 3 germ layers from each of these arches, right? And remember that each of these arch, they have its own blood supply, means artery of its arch and there will be nerve of each arch. Let me draw it so that you can understand it better, that these are actually arches like this, and this is like bilaterally spreaded on the ventral aspect of the developing pharynx of an embryo. So similar cut section of an arch will be here also, but I have drawn it only of one side. Now the important thing here is each of these arch actually ontogeny repeats phylogeny during the embryonic course. So we know the lower animals have 2 nerves for each arch, right? And as I told you that on the outside, because of these trench, right? Trench means a depression, and that's why the terminology here being used is pretrematic and posttrematic, right? So the terminology, according to that terminology, the nerve running above to the ectodermal cleft in the arch above, that will be called a pretrematic, and nerve which is running below to this cleft will be called a posttrematic, right? So let's say the main nerve for each arch, the main nerve for each arch actually runs along the upper border of each arch. These are the nerves for each arch, right? So these are the nerves for each arch, and you know them that the first nerve, or the nerve for the first arch is V3, the mandibular nerve. For the second arch, it is the facial nerve. Then for the third one, it's the glossopharyngeal, and for the the 4th and the 6th arch, 5th actually disappears, and for them it is the 10th along with the 11th cranial nerve. These are the nerves for these arches. So now, because I have already told you terminology, these nerves are running along the lower edge of these trenches, so that's why these are all posttrematic nerves. So in humans, I mean, the main nerve of each arch is posttrematic. That's why facial nerve is a posttrematic branch of second pharyngeal arch. And so you can remember 1, 2, 3, 4th and the 6th arch. Okay, fifth, is actually disappeared during the course of development. Now, each of these nerves within, when they're reaching into these arches, they give a branch which ascends up and it runs in the arch above, succeeding arch above, right? This is how each nerve gives a branch which runs in a succeeding arch above. So these branches will now be running above to the trench, and that's why these green color branches I have shown is called the pretrematic branch. Pretrematic nerve of each arch, while the yellow color ones, because they are running below to the trench, and that's why these are called the posttrematic nerves. Got it? So this is what's happening in the lower animals. In humans, this dual supply is only for the first arch. In the remaining arch, there's only one, that is the posttrematic nerve supply is the nerve that's the only nerve supply for the arches 2, 3, 4, and 6. However, in the upper arch, in humans also, we have two nerves, we have V3, that is the mandibular nerve, and that gives this nerve, the lingual branch. And let me tell you, you must have been taught about the development of the tongue, right? And there are these two lingual swellings. These lingual swellings, they actually develop from the first arch. So that the anterior 2/3 of the tongue is derived from the first arch. And that's why that lingual nerve branch of V3 takes the general sensations from the anterior 2/3 of the tongue, while this branch, the green color one, that's the pretrematic branch of the first arch, that this nerve is chorda tympani. This is a branch of facial nerve. So chorda tympani is a pretrematic branch of first pharyngeal arch, and it takes the special taste sensation, gustatory sensations from the anterior 2/3 of the tongue. Got it now? So that's the concept that you remember now, that especially for the first arch. Otherwise, all the branches below, they all have the posttrematic nerves as the only nerve for their arches. So remember now that facial nerve, in case if they twist the question, you remember that it's the posttrematic branch of the second branchial arch. Got it now? Okay. Now let's move further. Now we'll talk about the functional nerve components of the facial nerve, right? So talking about the functional nerve components, you should first of all have this idea that there are 7, the brainstem. In the brainstem, the arrangement of these nuclear columns of the cranial nerves, they have been arranged into 7 functional columns, and they have a bilateral symmetry. So here in between I have drawn is this as the median plane, right? So the median sulcus. So both the sides you have, the 2 halves of the brain stem. And there is another sulcus down. I mean, let me tell you that these are, let's say these are the lateral limits of the brain stem, right? So, and here I have drawn is, yes. So this you can say, again there is a sulcus between the efferent functional columns and the afferent functional columns, right? So, now let's say this is median sulcus, this is median sulcus, and this one is called sulcus limitans. This is called sulcus limitans. So this much functional column, here you seeing this much functional column, both the sides, it is carrying the efferent nuclei, and the later portion, this much functional column you are seeing is the lateral functional columns, and they are carrying the afferent nuclei. So this, this is called the basal lamina, right? This is called the basal lamina. Basal lamina. And this one is called the alar lamina. Okay. So here, this, the motor, the efferents, the efferent nuclei, they are medially placed. The sensory nuclei, the afferent nuclei, they are laterally placed, right? Okay, so this functional column, right, the medial most, the medial most is general somatic efferent for the skeletal muscles derived from somites, and that includes nucleus 3, 4, 6, and 12th. This is how these are the motor nuclei. And now talking about this one, special visceral efferent. So let me tell you, special visceral efferent is also called branchial efferent because it innervates the muscles derived from the branchial arches, the skeletal muscles. And this functional column, this will include like nucleus. This I have already told you. For the first arch, it's the mandibular nerve, right? Then you have the facial nerve. Then you have the glossopharyngeal nerve for the third arch, and then you have the 10th and 11th nerve together for the 4th and 6th arches, right? But important is that these three nuclei, they are together grouped in a single nucleus, and this nucleus is an elongated nucleus extending into both the open and closed part of the medulla, and this is called nucleus ambiguous. Okay, this is ambiguous. Then lateral to that is general visceral efferent, and general visceral efferent, you remember, that is parasympathetic. So parasympathetic outflow. And this functional column will include the highest placed nucleus. And now remember, in case if they ask in detail, it is Edinger Vespal PG. Edinger Vespal PG. I think I should write it small so that it's visible to you. This is Edinger Vespal PG. This concept I have already explained you. So this is Edinger Vespal PG nucleus, and the other one was CP, centrally projecting, which was not related to the eyeballs, movement of the eyeballs, or neither with the intraocular, neither with the extraocular muscles. So that they have separated out. Now this is Edinger Vespal PG. Then you have the nucleus here is, lacrimatory nucleus. And then you have superior salivatory nucleus. These are all at the pontomedullary junction. Lower part of pons and upper part of medulla, you find, is the inferior salivatory nucleus, right? Okay, and then you have an elongated nucleus, and that nucleus again is parasympathetic, and it's deeply placed in the lower, in the medulla, in the open and closed portions. And this one is now for the 10th nerve, and this is called the dorsal nucleus of vagus. Got it? Okay. Then talking about now the afferents. Afferent functional column, you have general visceral afferent and special visceral afferent. So general visceral afferent brings the pain, temperature, pressure, touch sensations from the viscera, and this one, special visceral afferent, brings the gustatory sensations, the taste sensations. So this is also important, that let me tell you that this actually groups the two sensations, and there is an elongated nucleus for this also, and which combines the two, this and this, they are combined here in this single nucleus, and this nucleus in its upper portion, it's like, like divided. So general visceral afferent nuclear columns is placed above, while special sorry, this is wrong. The VIPs are asked to sit up, so above. So special people. So remember that special visceral afferent fibers relay in the upper portion, while the general visceral afferent fibers relay down in the lower portion of the nucleus, and this nucleus is nucleus of Tractus solitarius. Okay, the combined nucleus of the two visceral general and special visceral afferents. And now we're talking about general somatic afferent, like the touch, pain, temperature, vibration, or 2-point discrimination, stereognosis, all general sensations on the outside, the cutaneous sensations, they will be brought in, including the proprioceptive sensations. Now these will be brought in here, and this functional column has a single elongated nucleus, and this nucleus is so long that it reaches down below into the spinal cord up to C2 spinal segment. So here the upper portion here is called the mesencephalic nucleus, the mesencephalic portion. This is the main or the chief sensory nucleus of the trigeminal, and this is the spinal nucleus of trigeminal. The name spinal is given because it reaches to the spinal cord. So this completely is the trigeminal nucleus with its three extents: mesencephalic, chief sensory nucleus in the upper pons. This mesencephalic reaches from pons to the midbrain above, and this is the upper portion of pons. This is chief sensory nucleus. Spinal reaches to the lower pons of pons, medulla, and the spinal cord. Okay, so remember that facial nerve is closely related to this also, because this is receiving the general sensations, extroceptive sensations from the face, while facial nerve supplies the motor nucleus, supplies the muscles of the face. So for that there was winding of the facial nerve nucleus around the abducent nerve nucleus, forming a facial colliculus. The purpose was to bring to the facial nerve fibers come close to this spinal nucleus of trigeminal, and that curving of this facial nerve is called neurobiotaxis. Okay, so the last one you are seeing here, it is like this functional column has this type of nucleus, and this has 4 parts, and this is the the vestibular nucleus. It has superior, inferior, medial, and lateral components. I think I should have better drawn it this way, that it has superior, medial, and inferior components like this. I think it should be better drawn it as like this. Yes, superior, inferior, medial, and lateral. The inferior one is also called as spinal portion. Okay, then there was 2 nuclei above and below to the inferior attachment of the inferior cerebellar peduncle to the medulla, and these are superior and inferior, or ventral and dorsal cochlear nerve nucleus. So the special sensations, special somatic afferent sensations include the vestibular and hearing functions, and for that this 8th nerve nucleus is the lateral most nucleus. After going through now the details, this was a summary. Now you should understand that about facial nerve. When I'm talking in facial nerve, you won't have this component, right? This will be not there in facial nerve, and the last one will not be there in facial nerve. Now focus upon facial nerve with the topic which I am discussing here. So in facial nerve, out of the 7, the middle 5 segment, functional components, all of them will be seen in facial nerve. So facial nerve is neither a pure motor, neither pure sensory. It has mixed functional components. Out of the 7, it has 5, the middle 5 segment, functional components. If you know the exact pattern, you can delete the medial most, you can delete the lateral most. The remaining 5 are the functional components of facial nerve, right? So you can delete them from both the sides. This is the functional columns of facial nerve. Okay, So I believe you understood. Now let's move to the next slide. Now we are talking about is the functional components of branches of facial nerve, right? So those are the 5 functional components of facial nerve, and how those functional components are running along with which branch, what functional component is being carried, that we're going to study here. So out of those 5, remember this in intrapetrous portion, these are the branches here you're seeing here. These are the branches of the intrapetrous course of the facial nerve. And the 3 branches, the first branch given out facial nerve is the greater superficial petrosal nerve. So remember, it carries 3 functional columns. General visceral afferent, this will bring in sensations of touch, pain, pressure from the soft palate. And general visceral efferent, this will cause parasympathetic, it will cause secretions from lacrimal gland, from mucosal glands of nose and palates. And you have special visceral afferent, this will bring taste sensations from the soft palate, hard palate. So that was about the greater superficial petrosal nerve. Now stapedius, stapedial nerve, this will supply the muscle derived from second branchial arch. So this is special visceral efferent nerve to stapedius. Now chorda tympani is the same nerve as greater superficial petrosal nerve, having all those 3 same functional components. Chorda tympani will carry, remember I am telling you, if you are understanding these functional column with each of the nerves, this will help you solving the MCQs also. So chorda tympani carries functional components what? The same the general visceral efferent. Now these are the parasympathetic outflow to the submandibular and sublingual salivary glands, secretomotor fibers. You have special visceral afferent. Now this will bring taste sensations from the anterior two-thirds of the tongue except the circumvallate papillae. And general visceral afferent, remember this is not from the tongue. From the general sensation of the tongue are being brought by lingual nerve, remember. Now that's branch from V3 which I've already told you how that tongue and anterior two-thirds were developed from the first branchial arch, and there was the pretrematic and posttrematic branch, right? So that was separate, so don't confuse with general visceral afferent with the tongue. General visceral afferent sensations here, it is bringing in actually from the 2 salivary glands which were being innervated, like submandibular and sublingual salivary gland. So the general visceral afferent sensations from those glands are being brought in through the chorda tympani nerve. Got it? So that's what about the intrapetrous. This is intrapetrous. This is intrapetrous branches. Now I'm talking about the auricular branch of facial. Now after emerging from the stylomastoid foramen, the branch that it gives first, that is the auricular branch of facial nerve. So it winds behind and it will supply auricular branch of facial nerve. Actually it will actually bring in the exteroceptive sensations from the outer portion of the external auditory meatus, and possibly it is either carrying itself or through along with this auricular branch of vagus, that's called Arnold's nerve, might be in combination with that nerve, it brings those sensations. So because vagus also has enough supply at the external auditory opening of the external auditory meatus, while rather vagus have a more of nerve supply in the external auditory meatus. So anyways, this also have a contribution to the sensations, and this, let me tell you, you will get to know when we'll talk about Ramsay-Hunt syndrome, right? There was herpes zoster infection, so there were vesicles created in the external auditory meatus. So from that means the virus travels along from geniculate ganglion to this, that proves that facial nerve does reaches to the external auditory meatus. Anyways, so Ramsay-Hunt syndrome, remember, keep remembering, I'll remind you later on also. So auricular branch of facial nerve carries the general somatic pain, temperature, touch sensation from the external auditory meatus. So that was this functional component. Now the the motor component for the second branchial arch, that is branchial efferent or special visceral efferent. This is for the muscles.
Now you know that facial nerve supplies the muscles of the second branchial arch is fine, but what are those muscles? The main of the muscles are actually the muscles of the facial expression. There are few muscles which elevate the hyoid bone like stylohyoid, posterior digastric, and there are muscles which move the pinna, especially this one, the posterior auricular muscles and the intrinsic muscle on the back of the ear, as well as the muscle of the scalp, and that includes the occipitalis, occipital bellies of occipitofrontalis. So this muscle, this nerve, posterior auricular nerve, and the other nerve here is the nerve to stylohyoid, as well as nerve to digastric, posterior belly of digastric. So remember, posterior auricular nerve to stylohyoid, and why not include nerve to posterior belly of digastric. So these are the three branches, and all the muscles, they have already, I have told you, they will be supplied here by special visceral efferent component. And finally the nerve, when it enters into the parotid gland, and it gives out like 5 terminal branches to supply the muscles of the face, and those are the terminal branches. They are also special visceral efferent or branchial efferent. So that's how the 5 functional components have been distributed by these different branches of facial nerve. Okay, so now let's move to the next slide. Okay, now look here, we are approaching toward the animation thing. So before starting with the animations, you should have an idea about all this thing what I have been drawn. I've drawn here. So just focus on here. I have drawn this is the overview of facial nerve anatomy in this skull, right? This much portion, there is the extracranial also. The branches coming out. Now look here, first of all we'll start with the nuclei, the different nuclei associated with facial nerve. This one is the motor nucleus of facial nerve, and this is special visceral efferent. So this will be lateral to this nucleus. Now this nucleus is the abducent nerve nucleus. So this one is abducent nerve nucleus, right? So this is general visceral, general somatic efferent. So this will be medial most, and this will be a little lateral. So that's how this from motor nerve nucleus, facial nerve fibers ascend, wind up medially and upwards, and will wind around the abducent nerve and will coil up and then descend down. So that means this coiling will make a protuberance on the floor of the fourth ventricle. That's called facial colliculus. The movement is called neurobiataxis. The next nucleus you are seeing here is the blue color one. Remember the color coding, it will help you also. So the blue color that I have shown here is what? It is the general visceral efferent, the parasympathetic outflow, and that's from superior salivatory as well as from the lacrimatory nucleus. So like the green color fibers I had just told you is branchial efferent or special visceral efferent. See the course, they passing along this course from the entire facial nerve canal, they exit out and they supply the muscle supplied here is stapedius once within the cranium, and then it supplies posterior digastric, stylohyoid, and the the posterior auricular muscles, occipitalis, and all. Then this is the terminal branch which will supply the muscles of the face. So the green color thing has been explained. Now look here, the next, the blue color one, the blue color one, that was parasympathetic outflow. Can you see now the blue color one, functional components moved out only into 2 branches. One is the superficial, greater superficial petrosal nerve, and the other one is chora tympani. Okay, this one will follow the lacrimatory secretions as well as mucous secretions from the nose and palate, and this will be for the secretions from the submandibular and sublingual glands. Then about the afferents, right? There was the only 2 efferents. Now there were 3 afferents. The 2 afferents, remember, one was the general visceral afferent. So general visceral afferent will be brought in here through the greater palatine nerve, lesser palatine nerves, right? So they will bring in sensations from the soft palate, hard palate, right? and the general sensations will be brought in by this again greater petrosal nerve, and the course will be again same, and these sensations will be relayed here where general in a lower batting, right? So they will be in a they will relay in the lower portion of this nucleus, and that is nucleus tractus solitarius. The like here now, actually this one is not so significant. The general visceral afferent sensations from this chorda tympani is not so significant, because it brings only general sensation from the sublingual and submandibular salivary gland. As I told you, don't confuse with the anterior to the tongue. That's from different nerve, not from facial nerve. Okay, so they have this functional component in this also. Of course, it's here. You can mention it that this also is carrying being carried here the course. This is also the two nerves I told you are same. They have the same functional components in both superficial greater superficial petrosal nerve and chorda tympani. They are absolutely same, having the same functional components. Now about the special visceral afferent sensation, the taste sensations. Remember that this greater superficial petrosal nerve was bringing in taste sensations from the palate, right? So taste sensations on the palate are being brought through greater superficial petrosal nerve, and they will relay in the upper portion. Remember, ye kaun se sensation is special people are asked to sit above. So these sensations will relay in the upper portion of the nucleus tractus solitarius. Similarly, taste sensations from the anterior to the tongue will be brought in by the chorda tympani. Except the circumvallate, they will be brought in via the chorda tympani, and they also will reach here into the upper portion of the nucleus tractus solitarius. Lastly, what remains is the general somatic afferent, and for general somatic afferent, I told you it will be via through this posterior auricular nerve from the external auditory meatus, and those sensations will also be brought in via the facial nerve. But remember, these fibers will of course run along the course of the facial nerve, but they will relay in the trigeminal nucleus, and that's the spinal nucleus of trigeminal, right? So that's how now the facial nerve has so many 5 functional components. And before I should start, I should tell you a little more about this. So this is how just a fast backup, that these nuclei ultimately sum up, and there were 2 nerves formed. Remember, there was facial nerve, the main motor nerve, as well as a sensory component of facial nerve called the nervus intermedius. So M for motor, M for medial. Remember, motor nerve is medial at the emergence from the pontomedullary junction, while the nervus intermedius is lateral to that, and lateral to nervus intermedius will be the vestibulocochlear nerve. So together the 3 nerves, right? So facial nerve, motor and sensory component plus the auditory nerve. Together the 3 nerves will ascend upwards laterally and move towards the posterior surface of the petrous temporal bone, where they will find a internal auditory meatus. So there you finding is the internal auditory meatus, this one. So before moving on, you should have this idea about the internal auditory meatus. So just a fast revision, that internal auditory meatus, how will these nerves run, that is also important. So remember that this nerve actually is afferent, right? The vestibulocochlear nerve is an afferent nerve, and it is a big bulky nerve, thick nerve, right? So being thick and bulky, it is settled down, remember, in the auditory meatus, internal auditory meatus, and it will have a concavity or a groove, right? It will have a concavity on a groove on its upper surface, because the other nerve is running on its upper surface. I shouldn't actually use the other color for a nerve, but I'll have to differentiate. So remember, this I'm drawing is the facial nerve. So within this internal auditory meatus, facial nerve will run above the vestibulocochlear nerve, and because it's a bulky nerve, it will depress and form a groove on the vestibulocochlear nerve, and in between the two will be a smaller division, another nerve, and that is nervus intermedius, interpressed between facial and vestibulocochlear nerve. And last but not the least, don't forget that the other structures running here are the labyrinthine arteries and vein. Labyrinthine artery and vein, they also a content of this internal acoustic meatus. And one more thing is, all this will be surrounded by the meninges. Remember the first, second, and the eighth nerve, this pure sensory. So I mean the meninges, in fact, they line all the intracranial courses of all the cranial nerves, but here they will be thickened and they will carry the CSF also in the subarachnoid space. So this neural sheath, the meningeal sheath surrounding these nerves, perineural sheaths, they will reach here in this internal acoustic meatus. Okay, so this was about the thing, and you remember then an artery perfuses this portion of the nerves structures here, and this artery is labyrinthine arteries. Labyrinthine arteries. So the labyrinthine arteries, these are branches of the basilar artery. So they are perfusing the nervous structure here, and few branches from it even continue in the facial canal to perfuse the nerves here in the facial canal. Now when this all the three nerves, they ascend, they move further, they will reach here in the the fundus, at the fundus. Now you can say that's the fundus of the internal auditory meatus. What is happening here? This also is an important thing. This you also need to draw and understand, because the questions might come on the diagram based thing. So slightly an elliptical structure at the fundus of the internal auditory meatus, and this structure, it's been divided by a crest, the transverse crest, into two areas. And because, let me tell you, the afferents, as you see, this vestibulocochlear nerve is very bulky, and all the fibers have joined and form a single bundle, that's vestibulocochlear nerve. But while at the fundus, remember, cochlear fibers are running separately while the vestibular fibers are running separately. So at the fundus, and the reverse is for this facial and nervous intermedius. Facial and nervous intermedius are separated here because they are efferents, right? So facial nerve and nervous intermedius join to form a single bundle by the end of fundus of my internal auditory meatus. Here they become a single nerve. So I'm using the same color code. Remember, first of all, now which that's why they have divided this portion into a superior vestibular area and an inferior vestibular area. This is I have drawn is a fundus, and this of the fundus of the left internal auditory meatus. So which nerve which run in the upper compartment, which nerve will run in the lower compartment, this I'll help you to understand, and I'll try to make you learn a little bit unofficial language. So if you remember that facial, F for fly means udna, right? तो ये ऊपर उड़ेगी means, and दूसरी another thing is this is cochlear nerve, as I already told you, is bulky. It's a big nerve, so it's bulky. So being bulky, it's heavier, it will stay down. So remember this way, that now facial nerve being lighter, it is running in the upper compartment. This blue color thing, I have already used the color code to make you understand that this one is facial nerve. Okay, I believe I am speaking, so I need not write everything. There is very less of space, so keep understanding. The facial nerve I have drawn, and this facial nerve, remember, it includes, or let me draw it this way, that it includes the nervous intermediates together, a common bundle. Okay, Then the cochlear nerve. Remember, the cochlear nerve is bulkier nerve and it is big nerve, and it is lying here in the lower compartment or the inferior vestibular area at the fundus. So this one becomes the cochlear nerve. Cochlear nerve. Now about the vestibular fibers, because it's incoming nerve, right? It's bringing in sensations, so the fibers have yet not united. The fibers from the semicircular canals, the crista and from macula are coming out separately. At the fundus, they are all separated in separate bundles. So how to remember that? I'll try to help you learn this. Look here, now the fibers, remember, coming from the crista of semicircular canals, they were bringing in dynamic or the kinetic balance. So fibers carrying the sensations of kinetic and dynamic balance, they are coming up here in the upper portion of the superior, superior vestibular area. So this is from anterior and lateral semicircular canal. Got it? Then, and why they are coming from upper compartment? Again, to make you learn. Remember, the dynamic and kinetics make you jump, make you somersault, or make you clumsy, make you fly. All these words, remember. So you'll remember these. These fibers will be running in the upper compartment of this, because they are flying. You can this makes you dynamic, like make you jump above the ground. While there are fibers. I'm using this color. Yes. Fibers coming from the macula of the utricle and saccule. Remember, these fibers are, macula of utricle and saccule. They're bringing in sensations of balance, right? Which balance? The static balance. That means they make you stand on the ground in maintaining a posture. Maintaining your equilibrium on the ground. So that means they are attached to the ground. I mean, it is helping you stand on the ground. So जमीन से जुड़ रहे हैं ना, नीचे की तरफ होंगे कि नहीं. तो इसलिए इसको याद रखना कि remember that this is from the macular fibers from the utricle and saccule. Ultimately, what left out is, yes, one semicircular canal, that is the posterior semicircular canal. So fibers coming from the posterior semicircular canal are left out. So, and how to make you learn that now? I think this color is been left out. I'm using this. So remember now, important thing is that the fibers coming from the posterior semicircular canal, they will be coming through the low vestibular area. How to remember this? Like there was, imagine there was the fibers coming from the crista of anterior, lateral and posterior semicircular canal, and there was a race. So anterior and lateral, they were fast, and they started flying. But P for posterior, P for piche. In Hindi, you call piche. Piche means you are late. When you are late, you stand by the ground. So P वाले जो है ना, posterior वाले, ये पीछे रह जाते हैं. पीछे रह जाने का मतलब है उड़ नहीं पाते हैं. तो ये पीछे रह जाएंगे. यानी remember that posterior semicircular canal fibers will stay down in the lower vestibular area. Another important thing left out here is that these fibers come out through a small little aperture here, and that is called, anybody? This is called foramen singulaire. Foramen singulaire. Hold on. This is called foramen singulaire. So fibers. I mean, this can be a simple MCQ, which fibers come from foramen singular. So remember, the fibers from the posterior semicircular crista of the posterior semicircular canal, they emerge through the foramen singular in the fundus of the internal acoustic meatus, right? So that was just important things. So I have described you because this will help you in your MCQs and all. Now this will facial nerve. We'll focus upon this nerve, the facial nerve, right? This one is the facial nerve running in the superior vestibular area. Now this will course out separately and will run through this intrapetrous course called the facial canal. So this facial canal, initially it runs downward, forwards, and when below to this tegment tympani, and then when it reaches there on this upper surface of the promontory, it takes a sharp bend. And when it takes a sharp bend, it runs now medially in this along the medial wall of the middle ear, and then it gradually first of all it takes a sharp bend, and that sharp bend here is called genu. This is called genu. And then it takes another gradual bend. This is the second portion, and after that the second bend, and it descends down vertically, running in the posterior, the promontory, in the medial wall of the middle ear, and then it emerges out from the stylomastoid foramen, right? And don't forget, this all nervous tissue running in the bone needs blood supply also. So there is an artery which ascends up from the other side also, from the stylomastoid foramen. This artery now is what? Remember, this artery was, yes, they have already marked it as Labyrinthine Artery. Now this artery is actually Stylomastoid branch of posterior auricular artery. Mainly, that's a branch of external carotid. So mainly the stylomastoid branch is a branch of posterior auricular artery, but sometimes it is even seen to be a branch of occipital artery. Okay, so that means this canal should have a perfusion inside, and so the blood supply is from both the ends. Okay, so that's how this nerve emerges out, and that and this intrapetrous portion, let me tell you now, you can see here that there are three nerves given out. Number one, this one is greater superficial petrosal nerve, and this is arising from this geniculate ganglion. Remember, there you find one, these are the cells, afferent nerve fibers. They have this pseudo unipolar neurons, or gustatory they will have bipolar neurons. The cell bodies will be placed here, so that's why it's a collection of cell bodies outside the CNS. So this is the sensory ganglion. So this will be this is a geniculate ganglion. Mind you, there are a lot of questions come upon this. So this is a geniculate ganglion. This will be homologous to the Gasserian ganglion of trigeminal. This will be homologous to the dorsal root ganglion of the spinal nerve. This will be homologous to the spiral ganglion of cochlear nerve, or to the Scarpa's ganglion of the vestibular nerve. So that's the geniculate, right? Now it will give the second branch. The second branch in its course will be nerve to stapedius. Third will be this chorda tympani. So there are three nerves given out in its intracranial or interpetrous portion, right? Then the fourth branch, as it emerges out, it will give this branch called the posterior auricular branch. And the fifth branch is sometimes a common branch, which splits to divide two muscles, posterior belly of digastric as well as the stylohyoid, and the sixth one is the terminal branch. Now this sixth one actually supplies the muscles of the face by passing through the parotid gland into 5 terminal branches. So that's what all about the different branches and everything. Now we will study about the this slide. Actually I'm trying to cover up maximum, so that next I'll it will be easy for me to show the animations. Now look here about this first branch, the greater superior petrosal nerve. So while it's right in a intrapetrous course from this geniculate ganglion, this branch called greater superficial petrosal nerve, it will pierce this tegmen tympani, that's the anterior wall of the petrous temporal bone, or you can say it forming the roof of the middle ear. And there is a small hiatus, that's hiatus for greater petrosal nerve, from where this nerve emerges and it descends downwards, forward and medially in the middle cranial fossa, approaching the foramen lacerum. And when it reaches in the foramen lacerum, it meets this new nerve, and that nerve, remember, I'm trying to draw this color. It meets this new nerve coming from below, and this nerve joins this, and this nerve is deep petrosal nerve. So deep petrosal nerve is a sympathetic nerve, remember, coming from the plexus around internal carotid artery. So deep petrosal nerve, it joins this nerve, right, and the greater superficial petrosal nerve, and then runs through this pterygoid canal. So this is called the nerve of pterygoid canal, also called Vedian nerve. This is also called Vedian nerve. Then when it emerges out through this pterygoid canal, reaches this pterygopalatine fossa, where this ganglion suspended this pterygopalatine ganglion is topographically suspended through maxillary nerve, right, and then this this relays there, and ultimately this via greater and lesser palatine nerves, it supplies the mucosal glands of the nose and the palate, and they are branched through the zygomatic nerve. There is zygomaticotemporal nerve, from where the postganglionic parasympathetic fibers via zygomaticotemporal nerve will via the lateral wall of the orbit will reach the orbit and will communicate with this terminal or distal portion of the lacrimal nerve and will innervate the lacrimal gland. So that was the course there. Now the stapedial branch, remember, while it's running in this course, it reaches this pyramid onto which the stapedius muscle is attached. So at the base of the pyramid, it gives this nerve to stapedius. And the third nerve is the chorda tympani. Now look here, this chorda tympani is actually given out just around 6 millimeters above to this opening stylomastoid foramen. 6 millimeter is the branch, and by the posterior wall of this middle ear, it perforates this posterior wall and enters the middle ear cavity, that's called tympanic cavity. And in the tympanic cavity, it passes between the malleus and incus, and it's very closely passing through this tympanic membrane. And when it reaches the anterior wall, it perforates it, or rather it passes through the petrotympanic fissure. So remember, there are very much chances of injury of this chorda tympani. What the name is, chorda means a thread like, and tympanic cavity, so that's like thread within this middle ear, this chorda tympani nerve, that's why it's called this. So in case of otitis media or any person, there are a lot of infection, a lot of clinical conditions where this chorda tympani can get injured. Anyways, so when it emerges out through this this petrotympanic fissure at the inferior surface of this middle ear, then when it emerges and comes down into the infratemporal fossa, and this nerve emerges in the infratemporal fossa, remember, it passes medially to the styloid process. It winds medially to the styloid process. What winds laterally to the styloid process is facial nerve. So facial nerve is winding laterally, and chorda tympani is winding medially to the styloid process. And when it descends down, there it joins this branch, foramen ovale. From there, what is coming down is mandibular nerve, and what is coming from the anterior division mandibular is lingual nerve. So there, chorda tympani joins the lingual nerve, and the further course of this chorda tympani is along with the lingual nerve to reach the tongue, then to reach and supply the submandibular salivary glands. All the further distribution of this chorda tympani is along with the lingual nerve. Got it now? Okay. Now finally, when this nerve emerges out, now the further branches is like posterior auricular branch. Let me tell you, this is the first branch and its extracranial course, and it winds behind. Now this wind behind, behind the external auditory meatus, and in between the mastoid process and external auditory meatus there's a groove, and when this groove, it's this posterior auricular nerve in, it reaches behind, it supplies posterior auricularis muscle, intrinsic muscle of the ear pinna, and it moves the pinna behind, and it further ascends and reaches to supply the occipital bellies of the fronto-occipitalis. Okay, then this another branch you're seeing here, this one branch is actually to the muscles which elevate the hyoid, and out of these, remember, there's two branches. One is nerve to the posterior belly of the digastric, which is a shorter or a smaller branch. The nerve to stylohyoid is a longer branch, right? And maybe sometimes the two nerves arise separately or sometimes together on a single twig. Anyways, they split out to supply the two muscles. Okay, and now this terminal branch, which we call as facial nerve, still we call it as a facial nerve, which continues. Now this nerve, remember, the terminal portion of the facial nerve, it will continue winding laterally to the styloid process, and then when it reaches further, it actually pierces the parotid gland where on its posteromedial surface, and it enters the parotid gland, and you can say medial to the neck of the mandible. Within the parotid gland, this facial nerve will split, and what lies medial to this nerve within the parotid gland? It will be the retromandibular vein and external carotid artery. Got it? Okay, so those are medial. This will be superficial in the parotid gland. Now in the parotid gland, there were also embedded parotid lymph nodes also. Those are the structures, in case they ask what are the structures in the parotid gland, there are lymph nodes also, deep parotid lymph nodes. Anyway, so now this nerve will split now. Remember, in the parotid gland, behind to the neck of the mandible, this facial nerve within the parotid gland splits into upper and lower division. The upper division gives, zygomatic and, this temporal and zygomatic branches. The lower division will give buccal, marginal mandibular, and the cervical branches. So all of them, the five, and remember that the buccal will split into two, upper buccal and lower buccal, and both the upper and lower buccal will run along the this parotid duct, above and below to the parotid duct. All of these branches will emerge from the anterior margin of the parotid gland, and what will arise from the apex of parotid down below? It will be the cervical branch of facial nerve, which emerges from the apex of parotid gland. And there was other structure which emerges at the apex, was the two divisions of the retromandibular vein. Anterior and posterior division of the retromandibular vein also emerged, at the end of the anterior and posterior margins, and at the apex it's the cervical nerve. Got it? So that was all about the course and all the branches. All what I could have covered in this, I have covered up. So if it's becoming extensive lecture, you can stop it, you can pause it, you can go through it in your next sitting. But I have to complete all it in one sitting, so I'm trying to cover up maximum. Okay, so now let's move to the animation portion of the,